So for those of you who are perhaps not as familiar with JBI, our vision and mission are to provide better evidence to achieve better outcomes and a brighter future. Our mission is not only to promote evidence-based healthcare, but also to support those trying to achieve it at the point of care. But we can't do that with just our little team of about 35 here in Adelaide. We work very closely in partnership with people around the world. Just to give you a little bit of background about this event, the idea of the solution room came from a powerful conference concept that aimed to engage and connect attendees and also to provide peer-supported advice on pressing issues. While this event doesn't follow strictly the concept, we really liked the idea and the pragmatism of pairing real-life challenges related to implementation and partnering with people to come up with some solutions. So they'll be learning on both sides of the podium, hopefully, today. We have JBI staff dotted around the room at tables who are really keen to interact with you. We haven't been able to do that in person for a very long time. And from our perspective, going back to our vision and mission, it's really important that we have opportunity to hear about what you're experiencing. So the event was originally designed to be exclusive to South Australia, but when we shared the concept with our international collaboration, they just loved this idea of connecting with people locally. And so the gLocal was born, and we now have 8 events running across 7 countries in addition to our event here today, both online and face-to-face, COVID permitting. So we're really excited that there's been such broad uptake of this around the world. gLocalisation was popularised by a gentleman, a sociologist called Roland Robertson, who traced the roots of the term back to a Japanese business term, which I will also get the pronunciation of probably wrong, dochakuka, which emphasises a global outlook adapting to local conditions. It stresses the idea of contemporary globalisation influencing the local level of society, but also vice versa. So what has this all got to do with evidence-based healthcare? You will see that the yellow wedge of the JBI model at the top speaks to both the globality and locality of evidence-based healthcare. The JBI model of evidence-based healthcare recognises first and foremost the critical relationship between research and practice. In simple terms, EBHC begins and ends with the needs of health professionals, of health services and of health service users. If we as researchers and synthesists are not engaged with the people who are using evidence, then we're never going to succeed at our end goal. So events like the gLocal Solution Room are really important ways of us determining what questions matter to you. What questions do you need us for us to help you to answer? And the fact that we have these events occurring in different contexts across the world, I think, speaks to the importance of that connection, that local connection informing the broader global agenda. In thinking about the application of evidence, obviously then, context is key. At JBI, we're cognisant that it's our responsibility not only to provide health professionals with the best international evidence, but also to support you to use it locally at the point of care. Again, that's not possible without connecting, without acknowledging and accepting that different cultures and clinical environments present different challenges. And we hope that this event, or rather this series of events, contributes to overcoming some of those barriers, to helping us understand the challenges that you're experiencing, and to provide an opportunity to co-create solutions together. I think it would be remiss of me to not talk about COVID in the current climate. No country or region has been spared throughout this pandemic. The crisis has really laid bare the stark weaknesses in almost every healthcare system. With and between countries, we've witnessed the disproportionate ability of health services to respond. We've also seen firsthand in real time both the successes and failures related to evidence implementation. To achieve a new normal, we keep hearing about this new normal, we're going to need a coordinated, coherent and cohesive response that is effective globally for sustainability. But that global approach will require local expertise to be successful. For decades to come, I'm sure that we will be reflecting critically on why some countries, some health services have been able to respond better than others to COVID. I suspect that at least in some instances, this will relate to how and whether, indeed, evidence was considered and utilised at a local level to make decisions. In the last 18 months, we've been, it's almost been like a stress test for evidence-based healthcare, I think, in some respects, and there have been lots of lessons that we've learned in relation to how and when evidence is applied. The model of partnership that we employ with our global collaboration leverages the strengths and competencies of our global community. It really values difference and promotes equity and diversity and inclusivity. And I think when we're talking about having a gLocal approach, that's really important. This graphic that I've got on the screen now is something that I've borrowed from authors in the education space who speak about gLocal knowing, gLocal acting and gLocal being. That is the ability to contextualise different types of knowledge, to work together across cultural, social, national, geographical context to identify sustainable solutions. And what I like about it is the pragmatism of it, which is something that JBI has been really connected with since it was started. The way in which we connect in order to make meaningful decisions using the information that we have available to us. That's precisely what this event is all about. As I said at the start, I'm filled with warmth and gratitude that we're able to be in this room together with a group of this size. I'm very mindful that there are people who are perhaps joining us online overseas who are not in a position to do that. So I'm very grateful that we're able to be here together. I hope you enjoy the wonderful program that Craig and the rest of the team have put together for today. Again, thank you to our speakers and our sponsors, and I hope you enjoy the program. Thank you.